Diphenhydramine, commonly known as Unisom, is an antihistamine that can be used to relieve symptoms of allergies, hay fever, and the common cold. These symptoms include rash, itching, watery eyes, runny nose, and sneezing. It can also help prevent and treat nausea, vomiting, and dizziness caused by motion sickness. Additionally, it can help you relax and fall asleep. This medication works by blocking certain natural substances in your body that cause allergic reactions, such as histamine and acetylcholine. It is important to note that cough and cold products containing diphenhydramine are not recommended for children under 6 years old, and some long-acting forms are not recommended for children under 12 years old. It's important to talk to your doctor or pharmacist for more details on safely using these products. It's also important to note that these products do not cure or shorten the length of a common cold and may cause serious side effects, so it's important to carefully follow the dosage directions. Do not use this product to make a child sleepy, and be cautious of giving other cough and cold medications that contain similar ingredients. Talk to your doctor or pharmacist about other ways to relieve cough and cold symptoms, such as staying hydrated and using a humidifier or saline nose drop/spray. As for the optimal timing and dosage, it's best to follow the instructions provided by your healthcare professional. When taking Unisom, it's important to follow the directions on the product packaging. If your doctor has prescribed this medication, be sure to take it exactly as directed. If you have any questions, don't hesitate to ask your doctor or pharmacist. You can take the tablet, capsule, or liquid form of Unisom by mouth with or without food. If you're using the liquid form, be sure to use a special measuring device or spoon to measure the correct dose. Don't use a regular household spoon as it may not give you the right amount. If you have a single-dose form of this medication, like a single-use whistle, you won't need to measure the dose. If you're using the rapidly dissolving tablet or strip, let it dissolve on your tongue and then swallow it, with or without water. And if you're taking the chewable tablets, be sure to chew them thoroughly before swallowing. The dosage of Unisom is based on your age, medical condition, and how you respond to the treatment. There are many different brands and forms of diphenhydramine available, so be sure to read the dosing instructions carefully for each product. Don't increase your dose or take this medication more often than directed. If you're taking Unisom to prevent motion sickness, be sure to take your dose 30 minutes before starting activities like traveling. And if you're using it to help you sleep, take your dose about 30 minutes before bedtime. If you're still having trouble sleeping after 2 weeks, be sure to contact your doctor. And finally, if your condition doesn't improve or if it gets worse, be sure to let your doctor know. Some common side effects of Unisom may include drowsiness, dizziness, constipation, stomach upset, blurred vision, or dry mouth/nose/throat. If these effects persist or worsen, it's important to notify your doctor or pharmacist. To relieve dry mouth, you can try sucking on sugarless hard candy or ice chips, chewing sugarless gum, drinking water, or using a saliva substitute. If your doctor has prescribed Unisom for you, they have determined that the benefits outweigh the potential risks of side effects. Most people who use this medication do not experience serious side effects. However, it's important to contact your doctor immediately if you experience any serious side effects such as changes in mental or mood, difficulty urinating, or a fast/irregular heartbeat. In the case of very serious side effects, such as seizures, seek medical help right away. While it is rare, a serious allergic reaction to Unisom can occur. If you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so if you experience any other effects that are not listed, be sure to contact your doctor or pharmacist. If you're in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Unisom, make sure to let your doctor or pharmacist know if you have any allergies to diphenhydramine, dimenhydrinate, or any other substances. It's important to discuss any medical history of breathing problems, high pressure in the eye, heart problems, high blood pressure, liver disease, seizures, stomach/intestine problems, overactive thyroid, or difficulty urinating. Be cautious when using Unisom, as it may cause dizziness, drowsiness, or blurred vision. It's important to avoid alcohol or marijuana, as they can increase these effects. This medication may also interact with other prescription or non-prescription drugs, as well as herbal products, so be sure to inform your doctor of all the products you use, especially before having surgery. For those who have diabetes, liver disease, phenylketonuria, PKU, or any other condition that requires dietary restrictions, be aware that liquid products, chewable tablets, or dissolving tablets/strips may contain sugar and/or aspartame. Liquid products may also contain alcohol, so consult your doctor or pharmacist before using these products. Parents should be cautious when giving this medication to children, as it may cause excitement instead of drowsiness. Older adults should also be careful, as they may be more sensitive to the side effects, especially drowsiness, dizziness, confusion, constipation, or trouble urinating, which can increase the risk of falling. It's important to discuss the risks and benefits with your doctor if you're pregnant and considering using Unisom, as well as before breastfeeding, as this medication can pass into breast milk and may have undesirable effects on a nursing infant. It's important to be aware of potential drug interactions that may affect how Unisom works or increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist, including prescription/non-prescription drugs and herbal products. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. Unisom may interact with certain products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, and other antihistamines. It's important to tell your doctor or pharmacist if you are taking any of these products. Also, be sure to check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. If you have any concerns, ask your pharmacist about using those products safely. Additionally, Unisom may interfere with certain lab tests, potentially causing false results. Make sure to inform lab personnel and all your doctors that you are using this medication. If you or someone else has taken too much Unisom and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include extreme drowsiness, seizures, and dilated pupils. In children, you may notice changes in their behavior or mood before they become drowsy, such as restlessness, irritability, or hallucinations. Make sure to keep all of your medical and lab appointments. This will help your healthcare provider keep track of how Unisom is working for you and monitor any potential side effects. It's important to stay in touch with your doctor while taking Unisom to ensure that it is safe and effective for you. If you forget to take a dose of Unisom, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take your next dose at the usual time. Don't take a double dose to make up for the missed one. Make sure to store Unisom at room temperature, away from moisture and light. It's important not to keep it in the bathroom or freeze the liquid forms. And of course, always keep medications out of reach of children and pets. When it comes to getting rid of Unisom, never flush it down the toilet or pour it into a drain unless you're specifically told to do so. Instead, make sure to properly discard it when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.